Hello, this is Dr. David Green, CEO of the New Jersey Pain Network. Today's topic is what you need to know about lumbar sympathetic blocks. A lumbar block is a procedure used to relieve pain in lower extremities from several neurologic and vascular conditions. The sympathetic nerves emanate from the spine and regulate a lot of activities that are behind the scenes, such as activating sweat, dilating blood vessels, the fight or flight phenomenon. This is called the autonomic nervous system. So who does well with a lumbar sympathetic block? Well, those who have RSD or CRPS, which stands for reflex sympathetic dystrophy, complex regional pain syndrome, phantom limb pain, postherpetic neuralgia, shingles, cancer pain, pelvic pain, non-operative peripheral vascular disease, and more. So the procedure is performed by having the patient lay on his or her stomach on an X-ray compatible table, and usually IV sedation is administered along with local numbing. Unilateral or bilateral approach is made if necessary. Bilateral is if the person has symptoms on both sides. You really wouldn't need to do bilateral if it's basically just one limb for RSD. And typically fluoroscopy is used so that the pain doctor will have real-time X-ray guidance and know exactly where the needle is going. Once the needle is accurately placed, just to make sure, the pain doctor will inject some dye to ensure that it's not in a blood vessel. And then once that's certified, then numbing medicine plus or minus some steroid is injected, and for longer lasting relief the pain doctor may use phenol or do a radiofrequency ablation. This is an example of the procedure. You see the person laying on his or her stomach, and then the needle goes around the spine and the injection occurs in the area where the lumbar sympathetic plexus is. Okay. Are there risks with the block? Well, there is a small risk of infection, nerve injury, bleeding, anesthesia, allergy to the medication. There's a small risk also of a dropped lung or some temporary numbness. Usually right away the patients will typically notice an increased temperature in the leg and the veins feel full. This is normal, and it means the block was positioned correctly. A temperature increase of 2 degrees Celsius means that it was a successful placement of the block. What are the outcomes with a lumbar sympathetic block? Well, they've been shown to be an excellent pain relieving procedure for those suffering from RSD and CRPS. And this was shown in a large study years ago. What that can lead to is, if necessary, a repeat injection or a lumbar sympathectomy where those nerves are basically obliterated. Oral opiates often just don't help so much with these types of conditions that involve overactivity of the sympathetic nerves. So the blocks can be very effective at reducing the need for opiate medications. The top non-operative pain management in New Jersey is through the New Jersey Pain Network. There are several clinics throughout the state accepting over 50 insurances and providing over 25 treatment options, including lumbar sympathetic blocks, with the board-certified award-winning doctors. Visit us online today at newjerseypainnetwork.com and then call us for more information and scheduling at 844-2NJ-PAIN. I'm Dr. David Green with the New Jersey Pain Network. Your pain stops here.